Hi everyone, my name is Jessica and today I'm going to be talking to you about the subtalar joint. So if you look closely over here at this picture, this is the calcaneus right here, and it is articulating with the talus, and that is what creates the subtalar joint. The subtalar joint is a diarthrodial joint and uniaxial since it does supination and pronation, and the posterior articulation is large, saddle-shaped, and it's a concave talus and a convex calcaneus. The anterior articulations are flatter with a convex talus and a concave calcaneus. So yeah, there we go. You see all of that right in here. And it leads to pronation and supination, as you can see right over there. So if we take a closer look over here at the muscles, there are several muscles that are important for the supination of the subtalar joint. So tibialis posterior, which is right over here, is very important, and I highlighted it so you can see it a little bit better, for supination of the subtalar joint. For your pronation muscles, that would be your tibialis anterior and all of the peroneus muscles. Those are all very important for the pronation of the subtalar joint. So if we hop on over to the ligaments, the primary ligaments that support this joint are the cervical, which is right here, goes right on up, and the cervical talocalcaneal ligament, and that helps inversion, and the interosseous talocalcaneal ligament, which helps eversion. So that's right here. And then just to give you a little reference, this is the talus bone, and then this is the calcaneus. So when this joint is pronated, it is somewhat flexible to allow for shock absorption of the ground reaction forces. And when this joint is supinated, it becomes very stable, allowing for a rigid lever for push-off. And if you have a lack of motion, then that can lead to a lateral ankle sprain. So if you take a look at my feet, so the pronation of the foot is when the foot flattens and becomes slightly longer. My feet right now are in pronation because they're a little bit more towards the midline. In a pronated position, the foot is flexible and able to adapt to the ground. The main muscles that cause pronation are the peroneal muscles on the outside of the lateral edge of the leg, and the main muscle that resists pronation is the tibialis posterior on the inside medial edge of the leg. Now for supination, the arch rises and the foot becomes slightly shorter. In a supinated position, the foot is rigid and able to act as an efficient lever for walking. The main muscle that causes supination is tibialis posterior, and the main muscles that resist supination are the peroneal muscles. So, if we want to take a look back up anywhere, so posture can be affected if this joint is too loose or too tight. So if your muscles are on the shorter side, that can actually lead to supination being more likely to lead to scoliosis. And if your muscles are on the longer side or they're more loose for the pronated muscles, that can also lead to a postural defect of scoliosis. Also, if you take a look at my feet, then you will see that if you supinate your feet, then your knees go away from the midline. So I don't know if these are the best pants to have worn for this, but when you supinate, your knees kind of go out to the sides, and then this can affect your hip angle, which can be affected by this, and they can go out a little bit more, and therefore that adjusts your posture. And then if you pronate your feet, your knees go a little bit closer to the midline. So I don't know if you can see that, but when I do it, my knees go a little bit closer to midline. That is going to affect your hip angle, and then that will adjust your posture overall. So if we take a look right over here, an injury that could occur would be a subtalar dislocation, often described as basketball foot, and that typically occurs if you land hard on the inside or outside of your foot, and that would really hurt. Another injury could be a subtalar instability, which involves a lateral weakness in which the ankle can suddenly give way. This can lead to the twisting of an ankle or chronic inflammation due to extreme pressure placed on the lateral ligament. So, with that subtalar instability, if you want to avoid the dislocation and the instability to the subtalar joint, you can wear supportive shoes and add a good arch support to your shoe. And try avoid standing or walking barefoot or in unsupportive footwear like slippers or sandals. You can perform calf stretching exercises for 30 to 60 seconds on each leg at least 2 times per day. So you can kind of watch me as I do this. So if you find a wall, go an arm's length away, and then what you're gonna do is take either of your feet and you're going to place it forward and wait until you feel that stretch within the back of your calf and just kind of lean into it for 30 to 60 seconds. And then do the same exact thing on your other foot. You can switch it with your other hand and just lean into it. And those are great stretches and exercises that you can do to help you improve your subtalar joint function. So if you ever injure this subtalar joint, which hopefully no one ever does, but if you do, there's an awesome doctor named Dr. Jonathan Padavina in Peterborough, New Hampshire, or in Keene, depending on the time of day or the day that you go and see him. So he can be found at the Advanced Foot and Ankle Specialists at 61 Summer Street in Keene, New Hampshire, or at Monadnock Community Hospital, 452 Old Street Road in Peterborough, New Hampshire. All right, thanks guys.